Nowadays, diabetes has become one of the most alarming global health issues. According to statistics from the World Health Organization, the number of people with diabetes is increasing rapidly, not only among the elderly, but also among younger generations. Diabetes not only directly affects quality of life, but is also the leading cause of serious complications, such as heart disease, kidney problems, and vision loss. In today's video, we will explore this condition in more detail, including its causes, consequences, and effective methods of prevention and management. 1. The two main types of diabetes. There are two main types of diabetes, type 1 and type 2. Both are chronic and serious conditions that affect the body's ability to regulate blood sugar levels. There are also some rarer forms of diabetes, but type 1 and type 2 are the most common. Type 1 diabetes often develops in children or young adults, although it can occur at any age. In this condition, the body's immune system mistakenly attacks the insulin-producing cells in the pancreas, leaving the body unable to produce insulin. Since insulin acts as a key that allows glucose to enter the cells and provide energy, the complete absence of insulin means that glucose remains trapped in the bloodstream, causing blood sugar to rise dangerously. People with type 1 diabetes must take insulin every day to survive. Type 2 diabetes is far more common and usually occurs in adults, though it is increasingly seen in children due to obesity and sedentary lifestyles. In type 2, the pancreas still produces insulin, but either not enough of it is made or the body's cells no longer respond properly to it, a condition known as insulin resistance. This also leads to higher blood sugar levels. Type 2 diabetes often develops gradually over many years, which is why many people are unaware they have the disease until complications appear. Whether it is type 1 or type 2, the common factor is that the body cannot properly use glucose, resulting in excess sugar in the blood, which can harm health if left uncontrolled. 2. The common ground between all types. The key similarity among all types of diabetes is that they cause blood glucose levels to rise above normal. Glucose is the body's main energy source, created when we eat or drink foods containing carbohydrates. After digestion, carbohydrates are broken down into glucose and absorbed into the bloodstream. In healthy individuals, the pancreas releases the right amount of insulin to act as a gatekeeper, allowing glucose to enter cells and fuel the body. In diabetes, however, this system does not work correctly. Either the body cannot produce insulin, type 1, or the insulin that is produced does not work effectively or is insufficient, type 2. In both cases, glucose becomes stuck in the blood rather than entering the cells. This results in chronically high blood sugar levels. Too much glucose in the blood creates many problems. In the short term, it can cause unpleasant symptoms such as thirst, frequent urination, and fatigue. Over the long term, persistently high blood glucose damages blood vessels and vital organs such as the heart, eyes, kidneys, and nerves. In other words, the major common ground in diabetes is a disruption in how the body processes glucose and insulin, leading to consistently high blood sugar levels and an increased risk of serious complications if the condition is not managed. 3. How the body normally works. In healthy individuals, the regulation of blood sugar is highly precise and efficient. When we eat or drink foods containing carbohydrates, the digestive system breaks them down into glucose. This glucose is absorbed into the bloodstream, raising blood sugar levels. As soon as the pancreas, located behind the stomach, detects this rise, it quickly releases a hormone called insulin. Insulin acts like a key. It unlocks the doors on the surface of cells, allowing glucose to enter and be used as energy. Thanks to insulin, glucose does not build up in the blood, but is distributed to muscles, the liver, the brain, and other tissues to power essential functions. When blood glucose begins to drop, such as during fasting or intense activity, the pancreas reduces insulin secretion and releases another hormone called glucagon. Glucagon signals the liver to release stored glucose back into the blood, ensuring that blood sugar remains steady. Through this coordinated system, blood glucose levels are maintained within a safe range, typically between 4 to 7 millimole per liters in healthy people. In short, in people without diabetes, the body naturally balances glucose and insulin, ensuring that energy is consistently available without causing damage to blood vessels or organs. 4. What happens in diabetes? In diabetes, this finely tuned regulation no longer functions properly. After meals, glucose still enters the bloodstream, but due to problems with insulin, it cannot reach the cells to be used as fuel. In type 1 diabetes, the pancreas produces no insulin at all. It is as if the body has lost its key entirely. As a result, even if the person eats normally, their cells are starved of energy while glucose builds up in the blood. In type 2 diabetes, the pancreas still makes insulin, but either not enough or the body's cells no longer respond to it effectively. This is called insulin resistance. It is like having a key, but the lock is rusted and does not open properly. In both types, the result is the same. Glucose accumulates in the blood. Prolonged high blood sugar levels lead to short-term symptoms such as thirst, frequent urination, and fatigue, and eventually damage blood vessels and vital organs. In other words, diabetes disrupts the natural balance between glucose and insulin, leaving the body in a state where blood sugar is too high, while the cells themselves are deprived of the energy they need. 5. Early symptoms. The early symptoms of diabetes usually appear when blood glucose rises above what the body can manage. Frequent urination. When blood glucose levels are high, the kidneys work harder to filter and remove excess sugar, leading to more frequent trips to the bathroom, including at night. Excessive thirst. Because of increased urination, the body loses more fluids, leaving the person constantly thirsty. Fatigue and lack of energy. Since glucose cannot enter the cells to provide energy, the body feels weak and drained despite high blood sugar. Unexplained weight loss. Particularly in type 1 diabetes, the body burns fat and muscle for energy since glucose cannot be used effectively. Recurring infections. High blood sugar creates an ideal environment for bacteria and yeast, leading to frequent infections such as thrush, skin infections, or urinary tract infections. Slow healing wounds. High glucose damages small blood vessels and weakens the immune system, slowing down the healing process. Recognizing these early warning signs is crucial. The sooner diabetes is diagnosed and treated, the lower the risk of serious long-term complications. 6. Long-term complications. If left uncontrolled, chronically high blood sugar can cause serious long-term complications by damaging blood vessels and nerves throughout the body. Cardiovascular disease. Diabetes significantly increases the risk of atherosclerosis, heart attack, and stroke. Heart disease remains the leading cause of death in people with diabetes. Eye damage. Diabetic retinopathy can damage the retina, leading to vision loss or blindness if not treated promptly. Kidney disease. High blood sugar strains the kidneys, reducing their filtering capacity. Over time, this can cause chronic kidney disease or kidney failure, requiring dialysis or a transplant. Foot problems. Poor circulation and nerve damage in the feet can lead to numbness, ulcers, infections, and in severe cases, gangrene that may require amputation. Nerve damage. Diabetic neuropathy causes tingling, pain, or loss of sensation, especially in the hands and feet. These complications often develop silently, but can be life-threatening. Fortunately, they can be minimized through strict blood sugar control, medical treatment, and healthy lifestyle habits. 7. Treatment and care. Proper treatment and care are the keys to living well with diabetes. For type 1 diabetes, daily insulin therapy, either through injections or an insulin pump, is essential as the body cannot produce insulin on its own. For type 2 diabetes, management often begins with lifestyle changes. Eating a balanced diet, reducing refined carbohydrates and sugars, maintaining a healthy weight, and exercising regularly. If lifestyle changes alone are not enough, doctors may prescribe oral medications or insulin therapy if necessary. 1. Slow digesting carbs: brown rice, oats, quinoa, sweet potato, whole grain bread. Slow blood sugar rise. Fiber and resistant starch release glucose gradually, reduce insulin spikes and improve sensitivity. Keep you full longer, supporting weight control. Heart health: oats lower LDL cholesterol. Gut benefits: resistant starch feeds good bacteria. 2. Non-starchy vegetables: leafy greens, broccoli, spinach, bitter melon. Slow carb absorption, lower glycemic impact. Packed with vitamins, minerals, antioxidants, protect blood vessels. High fiber, good digestion, prevent constipation. 3. Low sugar fruits, apple, pear, guava, grapefruit berries, kiwi. Natural sugar plus fiber, safer than juice. Rich antioxidants, vitamin C, polyphenols protect the heart, boost immunity, and reduce inflammation. 4. Lean proteins, chicken breast, fish, eggs, tofu, beans, lentils. Effects: minimal direct effect on blood sugar. Help preserve muscle mass, which increases insulin sensitivity. Fish, salmon, mackerel provide omega-3 fatty acids, anti-inflammatory, heart protective. 5. Healthy fats, olive oil, avocado, nuts, seeds, fatty fish. Effects: slow gastric emptying, lowering post-meal glucose spikes. Improve lipid profile, lower triglycerides, increase HDL, reduce inflammation, especially omega-3. 6. Legumes and nuts, lentils, chickpeas, walnuts, almonds, chia, flax. Effects: low GI combo of carbs, protein, fiber, steady blood sugar. Improve cholesterol levels and provide magnesium. Nuts deliver healthy fats that support heart health. Dairy, unsweetened milk, plain yogurt, kefir. Effects: good source of protein, calcium, vitamin D. Yogurt with probiotics may improve gut health and metabolism. Lactose raises blood sugar moderately if not combined with added sugar. 8. Drinks, water, tea, coffee, alcohol. Effects: water, best choice, no calories or sugar. Green tea, black coffee, unsweetened, polyphenols may improve insulin sensitivity. Alcohol may cause late-onset hypoglycemia, dangerous if on insulin or sulfonylureas. 9. Foods to limit. Why? Refined sugar, soda, sweets, very high GI, spike blood sugar. White rice, white bread, refined carbs, fast absorption, poor satiety. Fried, processed foods, saturated trans fats, worsen insulin resistance and heart disease risk. 10. General principles. Combine carb plus proteins, fat plus fiber in every meal. Small, frequent meals, 4 to 6 per day, help avoid big spikes drops. Cooking methods: prefer steaming, boiling, baking, grilling. Always monitor blood glucose after meals to learn how your body responds. Special considerations: insulin users, risk of hypoglycemia if meals are skipped or with alcohol. Kidney disease, adjust protein, potassium, phosphorus intake. Obesity, hypertension, high cholesterol, prioritize fiber-rich, low-salt, low-calorie foods. In addition to medication, patients must monitor blood glucose regularly, either through home testing or HbA1c blood tests, which provide a picture of average blood sugar levels over several months. Comprehensive care also includes regular checkups for the eyes, kidneys, and feet, early treatment of complications, and emotional well-being. Staying positive and connecting with support groups helps patients remain motivated to follow their treatment plans. With consistent treatment and holistic care, people with diabetes can live long, healthy, and active lives while minimizing the risk of complications.